Basically, if you have pain due to a nerve irritation or compression, will you actually recover from that pain? Will that pain ever go away? All right, before we get into the topic, my name is Swati. I'm an executive mom's power coach. So basically, I help moms who work at executive levels to overcome the physical challenges of motherhood. This could range from anything from back pain, neck pain, joint pain, um, poor posture, or a weak pelvic floor, and well, everything in between. So, let's talk about the topic today, which is, do pinched nerves ever go away? Now, what exactly is a pinched nerve? Or rather, before that, has a doctor ever told you for your back pain or neck pain that you have a nerve which is getting pinched in your neck or back, and that is what is causing all the pain? Now, you might be wondering, what exactly is this got to do with my nerves? How is a nerve in the neck causing pain in my hands, or in my back causing pain in my legs? So let's just briefly go into what is it, and then we'll answer whether it can actually go away. Now, what happens with pinched nerves is, basically, a pinched nerve is nerves that are exiting your spine at every level. The nerve can get irritated, it can get compressed. So, irritated means if this is your nerve and something is constantly touching the nerve and irritating it, or if it is actually pinching in the nerve and compressing it. Depends, it might be less compression or to a full compression, right? So depending on what is happening with the nerves, you'll get these symptoms. Now, pinched nerves can happen throughout your spine, that is your neck, mid back, or your lumbar spine, that is your lower back, or it could happen in your arms or your legs. An example of the one in your wrist would be a carpal tunnel syndrome. However, for this video, we are just going to stick to the spinal nerves for now. So, if you have a pinched nerve in your neck, you will have symptoms going into your upper limb. So, upper limb is basically your arm, your forearm, and your wrist up to your fingers. So anything from your, this neck, shoulder area up to your fingertips. Similarly, if you have pinched nerves in your mid back, that is your thoracic spine, you will have the symptoms in and around the trunk area, like for example in your chest. Just a word of caution here, if you do have chest pains, you probably want to get it checked out before you think it is a pinched nerve, because there could be a few other issues like heart issues that can mimic the same pain. Going to your lower back. So lower back, in sorry, the pinched nerves in the lower back can manifest as pain, tingling, numbness, etc., going right from your lower back into your glutes, that is your bottom, and down all the way down till your tips of your toes. So, if you want to know what exactly does a pinched nerve feel like, how does it manifest? Do you get pain? Do you get tingling? Do you get numbness? I have done another video on this, and it is on my YouTube, so you can go there and have a look at that video. And of course, if you like what you're watching, you can always like and subscribe. All right. So, I'm just looking at my notes here. So, yeah, so yes, another example I wanted to tell you for the pinched nerves in the leg would be a common one that most of us know is sciatica, right? So somebody might say, oh, I've got the sciatic pain, or sciatica, or sciatica as well. So that basically is a nerve that is getting irritated in your lower back, and then that's manifesting as symptoms down your leg. Again, there's a lot of YouTube videos I've done on this, so you can go have a look if you are suffering from sciatica. There are lots of helpful tips there as well. So, does it actually go away? Now, this question, the answer to this question depends on why and what is causing your pinched nerves. So, if you have, say, a poor sleeping posture, you have something that you do repeatedly, like repeated bending over, picking up some objects from the floor, we're looking at more lumbar lower back here. Or if you are in the habit of sitting with your neck protruded out like this, forward head posture. So if you're doing any of these activities, definitely you can work on posture correction. And if it is not too late, if you've not had this pain for like years and years, you can possibly come back to, if not 100%, you can cure, not, I won't use the word cure, but you can sort of get a bit of relief from these pinched nerves, to a certain extent. And if you have a pathology like a bulging disc, which is also known as a herniated disc, a stenosis, or anything else that is a disease or a condition in your back or your neck, and that is causing your pinched nerve, then you have to address that problem. And this is something you'll have to discuss with your doctor or your surgeon as to if it is possible to actually cure it medically or with surgery, right? So if they can manage that, say it's a disc that is causing your pinched nerve, if you can manage the symptoms of your disc, you will be able to affect the symptoms, you will be able to relieve the symptoms that are coming from your pinched nerves. So basically, whatever is the basic cause of your pinched nerves, you address that. So if the cause is in my neck and the pinched nerves are giving me, say, pain in my fingers, so instead of addressing just the fingers, I'm going to address what's happening in my neck. Okay. So usually, if it's like you haven't had the pinched nerve for a long time, it can go away, it can reverse with treatment and self-care management strategies over weeks or months or even years. There is a possibility that you do have a bit of chronic pain left over. It's sad, but our bodies usually don't go back to 100% with these conditions. There is always a bit of a residual effect even when you recover. So yeah, so you might have a few of these effects remaining, but it is possible to have a little bit of recovery from pinched nerve depending on what the cause is. All right, so that's all I had to say to you today. If you're looking for ways to manage your neck pain, back pain, or even your nerve pain, or if you have any queries or you want to know what exactly is happening with your spine and your pinched nerves, feel free in my community. I will leave a link in the description below. And for those of you watching me on Instagram, the link is in my bio. When you click on that link, it'll take you to another page which says My Community, and you can join from there. Alrighty, I hope this was useful. Just a bit of information about pinched nerves, because sometimes when we get these issues or the diagnosis from a doctor, we are like, oh my God, what is this? It's like you feel so overwhelmed. It is always good to know what's happening with your body so you can make an informed decision along with your healthcare provider, your doctor, as to what your further course of action for treatment should be. Alrighty, I hope that was useful.